This is a fantastic question. So, we don't have a healthcare system. We actually have a sickness care system. So I wait until something's wrong, and then I go see a doctor or go to the Emerge. And what happened pre-pandemic is I would try and make an appointment with my GP, and it would typically take me 3 or 4 weeks to get an appointment with her. And then when I did get the appointment, finally, down the road, my symptoms might have disappeared 3 weeks later, but I'd have to take a half day off work, and I would drive down and get a parking spot. I'd have to go at least an hour early because she was always running late. She's a very good doctor. She cares about her patients, but it can mean that I might have to wait for an hour. So I'm sitting in a waiting room with people who are coughing and sneezing and they have rashes. Is this ideal? And then I finally get to see the doctor, and she spends 5-10 minutes with me. And then off I am to the lab for some tests, where I'm in a waiting room with other people who are sneezing and coughing and have rashes. And I get some blood drawn, and then I have to go to the pharmacy. And what was ever good about this process? The pandemic has driven fundamental change where I had a problem during the pandemic, and I made an online telehealth appointment, and I got it the same day with a doctor for 15 minutes, and we solved my problem. And he could have prescribed medicines if I'd needed them. So we have seen 46% of hospital or medical visits during the pandemic be telehealth. So this is a genie that's out of the bottle that will never come back. And companies can help their insured pool by helping them to access this kind of care. And so I used, for instance, TELUS's Babylon Health, but we're going to see permanent changes due to this. And how do we get from a reactive system to a proactive system? So some companies in the US are giving every insured a Fitbit because on average, people end up doing 60% more steps and exercise when they measure it, which means they're a healthier population, which means fewer claims. So it's in the interest both of the client whose employees are being insured and the insurer to get healthier populations. So it's how do we reduce how do we improve the health of our insured? So Vanessa, thank you for this, a great kickoff question.